Hi, thank you, Jocelyn. I'm very excited to be here today. I wanted to take a few minutes to just tell you about Fair Count, what we do, and how we incorporate a healthy democracy into making sure that we have a healthy country in our work. So Fair Count, we are a nonprofit, nonpartisan organization, and we seek to end extractive organizing in historically marginalized communities and lay in its place long-term relationships using every iteration of civic participation. So we're talking the census, voting, and redistricting. And we use those as catalysts for continued civic engagement, as well as for fair and accurate representation. But at the core of everything that we do at Fair Count is a deep commitment to equity in power, equity in resources, and equity in information. And I personally, I am a scientist by training before helping start Fair Count. I'm an evolutionary biologist. I worked at the CDC before coming over here. And when I put these two careers or, interests of mine together, I personally don't think that we can have a healthy country if we don't have a healthy democracy. And, working at the CDC and just, being a Black woman, I know that health disparities have always been here, but the pandemic definitely brought these issues to light. And so at Fair Count, we believe that you can draw a straight line from the communities that are being undercounted in the census, underrepresented at the polls, have the communities that have their voting power broken up during the redistricting process. You can draw a straight line from those communities to the same communities being overlooked and under-resourced throughout this pandemic. And of course, back to, you can draw that line even further back before the pandemic, back to overall health disparities. So we strongly believe that an equitable democracy demands an equitable recovery. And that's why we're using the infrastructure and the relationships that we've built through non-extractive deep dive organizing to guide our work. And I'll tell you about 3 projects really quickly that we're working on. So the first is our Pandemic to Prosperity South report. This is in collaboration with the Southern Economic Advancement Project and the National Conference on Citizenship. And so we look at over 20 indicators that from obviously COVID rates, vaccination rates, but we also look at communities that are news deserts that may not be getting equitable access to information. We look at, the impact on food security and on the impact of the pandemic on food security, as well as internet access and all types of data. So we really focus on the data and use our infrastructure to disseminate that data. We have another program called Count Me In that is currently going on, and in response to low vaccination rates and vaccine information in Georgia and other states in the South. And so we're using our organizers and to do on the ground education, engagement, and we also have partnerships and events that are aimed at actually getting shots in arms. But again, it goes back to information, equity and access to information. And we want to make sure that people have the information that they need to make informed decisions about their health and the health of their families. And lastly, we have a program called Science for Social Equity that partners community organizers and scientists so that they can work on science-related issues together and work with those communities that they're specific communities to actually develop community directed and informed solutions to those problems. And so as a part, our fellows are working in several states. We have one pair of fellows who are working on vaccine distribution and education in Mississippi. We have a group in DC that's working on health literacy, and we have a group in Florida that's working on mental health education and making sure that there's a place for people, specifically Black millennials, to identify those resources. So I'll end by saying that our work is guided by data and community engagement, and this is what allows us to develop and implement community-driven strategies and solutions. And we would not be able to do this work if we did not have a strong belief in democracy and an equitable democracy. And with that, I will turn it back over to Jocelyn.